Good morning, everyone. My name's Dr. Louise Hanna, and I'm a consultant clinical oncologist in the Velindre Cancer Centre in Cardiff. And thank you very much indeed to the Pelvic Radiation Disease Association for asking me to talk about why we need a best practice pathway for pelvic radiation disease. And the answer is that this is a huge area of unmet need. If you think about all the different organ systems in the pelvis and the number of people having pelvic radiotherapy of all ages. Our treatments are improving, and so is our cancer survival. And there's an increasing emphasis on living beyond cancer and quality of life. And this has been highlighted in national cancer strategies and by national cancer charities, in addition to the Pelvic Radiation Disease Association. I've highlighted a quote here from the PRDA website from Dana, that a lot of people think that once the cancer treatment is over that you are better and you are back to what you were before, but that is not the case for some of us. So if we talk about the unmet need, radiotherapy is an important component in the treatment and cure of many pelvic cancers. And as the document states, there are around 100,000 people living with late effects of pelvic radiotherapy in the UK. And late effects can occur months or years after treatment, including when the patient has been discharged from follow-up. And to illustrate the unmet need, I can show some of our local data from Cardiff, where we've set up a late effects of pelvic radiotherapy service. And the blue line on the graph shows the number of referrals per month. And you can see the huge dip in referrals during the lockdowns in the pandemic. And these patients have symptoms that didn't go away during that time, but they were unable to access the support that they needed. So what are the late effects of pelvic radiotherapy? Gastrointestinal, urological and sexual problems are common, and people can also experience hormonal, bone, skin and vascular problems, together with lymphedema, pain and psychological worries. Very often, multiple organ systems are affected, and within our local late effects of pelvic radiotherapy service, we have a gastrointestinal nurse specialist, a gynecological cancer nurse specialist, a physiotherapist and a dietitian. And even within that small cohort, we found that only 43.2% of patients needed to see just one professional. And over half of the patients needed to see more than one professional group. We did a questionnaire survey of general practitioners, and we asked that if they see a patient for a consultation, would they typically know that the patient has had a previous cancer? And the majority of GPs would know this from the read code or problem summary. However, it is a very different story when asking about pelvic radiotherapy, and the majority of GPs that we surveyed would be unaware that a patient had pelvic radiotherapy unless the patient told them, or they asked it specifically, or they searched through the case notes. So, what do patients need? Our experience from our late effects clinic is that patients need clear advice. They need to feel listened to, and they need to be understood. They need an environment where they're comfortable discussing issues which can be very sensitive or embarrassing. And they need the treatment and care to be tailored to the individual, and they need to be able to access services even when they've been discharged. So what do we all need? We need to raise awareness, and we need a common language. We need our patients to be educated so that they can ask the right questions and be aware of avenues for support. And we need to educate ourselves in the different presentations, and we need pathways to guide our management. Pelvic radiation disease might be a very small proportion of a healthcare professional's clinical practice, and the more guidance and help that they can access, the better. A practice guidance will allow us to set standards that can be audited to allow quality improvement work, and will give guidance on what data can be collected. We need to be able to identify areas of research, and ultimately we need to set up and refine dedicated services to identify, diagnose and treat patients who have late effects of pelvic radiotherapy, with an emphasis on holistic care. So, can I commend to you the best practice pathway for pelvic radiation disease? This is a comprehensive, evidence-based, practical document in which the dedication and expertise of those who wrote it is evident on every page. It brings together all aspects of pelvic radiation disease with an emphasis on holistic care. Education, research and service development are highlighted, and I believe that this can be a flagship document which will be practice changing. I'm coming to the end of my talk now, and I'd like to thank the organisers once again for inviting me to talk at this meeting, and I do hope that you all enjoy reading and digesting the document as much as I have. Thank you very much, and I hope you enjoy the rest of the meeting.